Hello everyone, my name is Odoemene Juliet Ugochi. I am from Nigeria. I took a course on Policy Advocacy in Genetics and Genomics from Pan-African PGS Education and Research Initiative. Alright, I'll be discussing what I've learned from the course, how my view has changed, and the importance of considering ethical perspective in policymaking. The research of policy advocacy within the context of genetics and genomics has been both enlightening and transformative. Through this course, I have developed a deeper appreciation for the complexity of genetic science, not only in terms of technical dimensions, but also the ethical, the legal, and the social implications that accompany advancements in this field. Initially, my understanding of genetics and genomics was largely scientific. I focused on the potential of gene editing, personalized medicine, and genome sequencing to transform healthcare. However, as I engaged more deeply with the policy aspect of this course, I began to see how critical it is for scientists, for ethics, for policymakers, and the public to engage in dialogue about the direction and the impact of genetic research. One of the most significant insights I gained is the importance of advocacy in shaping policies that are equitable, that are ethical and inclusive. Policy advocacy is not just about promoting innovation, no. It is about ensuring that innovation serves the greater good, with marginalizing vulnerable populations. I learned that advocacy efforts must optimize issues such as genetic privacy, informed consent, discrimination, and access to genomic healthcare. The considerations are especially important in diverse societies where disparities in healthcare are already exist. My view have also evolved in terms of role of the public in policymaking. I now believe that science cannot exist in vacuum. Policy engagement and transparencies are vital in building trust and legitimacies for genetic policies. This course has helped me understand the necessity of crafting policies that reflect not only scientific but also societal value and ethical norms. The ethical dimension of policymaking in genetics and genomics has stood out as a cornerstone of responsible governance. With the rise of powerful technologies like CRISPR, we are faced with profound ethical dilemmas such as possibility of editing human embryo, the ownership of genetic data, and the potential for eugenics. Ethical framework help ensure that these technologies are applied in ways that respect human dignity and protect future generations. In conclusion, this course has reshaped how I view the intersection of science and policy. Policy advocacy in genetics and genomics is not just a bureaucratic necessity. It is a moral obligation. It ensures that scientific progress aligns with ethical principles and societal needs. Going forward, I am committed to being a more informed and active participant in policy decisions related to genetics and genomics, advocating for policies that are just, ethical, and forward-thinking. I would like to use this opportunity to encourage my colleagues from Nigeria, from Ethiopia, and from other parts of the country to engage actively in policy making in genetics and genomics. Thank you.